beside mind-body medicine, I am interested in spiritual medicine. That will be the topic of future in the same platform. Role of spirit, role of spiritual consciousness, higher consciousness in our health, in our healing. In my family, there is tradition, there is some that they are not very much inclined to allopathy medical practices, allopathy medicine. Even when I was a child, I was must be in 5th standard or 6th standard, I caught jaundice. And in my family, they cured me by just with natural treatment, no medicine, no cereal for 1 month. And it was a good time for me. Because as a child, I don't know about you and about many other people. Many children don't like to eat roti, chapati, and cereals. But yes, fruits and curd and things like that are more suitable. So it was a good time for me. I used to think why I didn't caught jaundice earlier. So in my family, there is exposure of natural healing, not very much focused on medicine, but in the society, academic level arrangement is mainly in allopathy field. In mind body medicine, there is no standard system as of it, and spiritual medicine is even far. So that is my personal interest, but due to lack of system, lack of formal course, I entered in MBBS field. I never liked the way the system works. I realized in OPD, people just keep coming after a few days to take next course of medicine. And in internship, what we used to do, just continue the same treatment. If there is no any significant change in the symptoms, just continue the same treatment. CST, continue the same treatment. So somehow from inside, I was not feeling this is right, but I had no capacity, I had no awareness. With time, I came to know about Louis Hay. I came to know about Dr. Joe Dispenza. I came to know about Dr. Brian Weiss. So the work of Dr. Brian Weiss falls in category of spiritual medicine. But Louis Hay, that is mind-body medicine. Dr. Joe Dispenza falls in the category of mind-body medicine as well as spiritual medicine. The placebo, the concept which we were talking just now, that giving injection of plain saline instead of painkiller. I have witnessed personal. There was some nursing staff, male nursing staff, senior citizen. He told me that we used to do in night duty, if there is no doctor, then I can't give painkiller injection. So we just inject the plain saline. And in most cases, patient feels good. Patient gets relieved. So this placebo is there, but we are not using properly. What Dr. Joe Dispenza researched, that if we can think, we can heal by thinking, then how to use our thinking capacity, our mind power in our meditation, how to deepen the meditation, how to reach the best meditation in shortest span of time. So the work of Dr. Joe Dispenza is very, very fascinating. I am a big fan of Dr. Joe Dispenza due to the work he is doing. But even he is not fully, his work is not fully accredited. It is working. Main practice is work on economy factors, market factors. if you are doing something, if there is appeal in people, you can run that profession. But systematically in academics, lifestyle medicine is emerging, especially the work of Dean Ornish, that medical professor who doesn't use medicine or surgery. Dr. Dean Ornish has declared himself as no drug, no surgery doctor. He works in academic sector and his lifestyle program. For decade, that's not a minor thing. In USA, insurance company also finance lifestyle program of Dr. Dean Ornish. And there was a gap of 17 years. Insurance company were not agree for giving the reimbursement for that program in which there is no medicine. Is it works? But it is not working. People were getting healed. Coronary blockage, even if it is of severe degree, it was getting reversed by lifestyle program. In that lifestyle medicine, mind-body medicine is very prominent. So topic of today is mind-body medicine. We have to understand role of mind. And this is future. I believe this is the future of medicine. With time, it will start getting more popular. First, I want to share few cases, remarkable case of healing using the power of mind. Stamatis Mouraitis, there was a Greek guy who shifted to America in pursuing better profession. He joined army. When he retired, at that time, around it is a story of 1970s. He got some breathing issues. When he get checked by doctor, there was diagnosis of lung cancer, and that was in stage 4, terminal stage. So doctor said that you have 6 months or max 9 months to survive. He thought, why to die in America? Let's move back to my country. I will die in my soil. From USA, he went to Ikaria. He was from Ikaria. And such thing happened that for that person who was supposed to live for 6 months, he lived for 3 decades. He died at the age of 98 years. His story has been published in many international media, New York Times, BBC. What he has done? He did nothing. Just he was living in his community with his childhood friends, in nature, eating local food. He was not doing his treatment, but he got healed. And it is not isolated case. There are dozens cases like this. Kelly Turner, who was psychology graduate, social psychology at Harvard, he came to know about one patient who had terminal diagnosis like stamatis, but she tried some alternative things, and she got healed. But interestingly, doctor of that patient told her, don't tell your story to other patient. Why? I don't want to give false hope. Kelly was surprised why the doctors are not studying this so-called spontaneous remission. Such cases are known as in medical fraternity as spontaneous remission. Why they are not researching the factors, how it got healed? She decided, I will do the research. She devoted 10 years She did PhD on the same topic, that how she got healed. The people, cancer survivor, natural cancer survivor. She studies around near about 1,000 cases of natural cancer survivor. Those cancer survivor who healed themselves without chemo, without surgery. She interviewed personally near about 100 people across 10 countries. She even came India, Rishidwar, the place between Haridwar and Rishikesh, to meet one healer. How they are doing healing. She found 9 factors, those cancer survivor, natural cancer survivor. And we had invited Mary Rust, one breast cancer survivor, natural breast cancer survivor, on our platform. She shared her story, what she did. Kelly found there are 9 factors. Those thousands of patients tried these 9 things to heal themselves. Among those 9 factors, 7 factors are related to mind. 2 factors are related to diet and supplement. So mind body medicine, what mind body medicine can do, we have to learn. This is the subject of future. There is no ability of much material who are widely approved. There are many people who are doing the work. Kelly Turner has written 2 books. Her first book, Radical Emission, are more profound. She has mentioned those 9 things: to work upon emotion, to strengthen self, to take responsibility of health in your hand. No one can heal you unless you are ready to get healed. But we have heard this idea, but working on that. And there is famous Louis Hay in the spiritual sector, in self-healing sector, self-help group. Louis Hay is quite popular. Mother of self-help, self-love movement. There are documentary, there are films on her life, on her teachings. You can heal your life. She has authored near about 10 books. One should read 3-4 books to fully grasp what she's saying. Louis Hay healed her cancer, uterine cancer, cervix cancer. And then she started helping people, and hundreds of people get healed by her mind-body approach. Influencing the mind by our words. We have case of Norman Cousins, ankylosing spondylitis. Ankylosing spondylitis is a disease of joints, bone. There is joint pain, there is body pain. And in severe cases, in many cases, there's so much pain that patient feels terrible. Norman Cousins had been declared by doctors that you have not very long life. Ankylosing spondylitis is non-curable disease, and we have no cure, we have no medicine. Norman Cousins started discovering by himself what to do. He started working on his mind. He started doing laughter therapy. He tried many things and he healed himself. He has written one book, Anatomy of Illness, Perspective of Patient. Norman Cousins is not doctor, but since he healed himself from an incurable disease, so it's worth studying. In medical community, we have tendency to ignore such cases, such people who are writing the book, who are doing the things, but not taking them seriously. This trend has to change. Then only mind-body medicine can flourish. We can understand how things are happening. But yes, few works has been done. I'm going to mention those work, and there's one profound work by Herbert Benson, Dr. and Professor Herbert Benson. There's Mind Body Clinic at Harvard, started by Dr. Herbert Benson. In 70s, he got interested in meditation. At that time, there was wave of transcendental meditation, TM, started by Maharishi Mahesh Yogi. Beatles group came to India, Rishikesh, to Maharishi Mahesh Yogi, and due to Beatles group, transcendental meditation became very famous. So Herbert Benson started studying first TM, and then he studied many other meditation methods. Work of Herbert Benson is first established, respected work on mind-body medicine. So far, very few researches has been done. There are many researches, but in compared with the research which is happening in the pharmacology, in understanding the physiology of disease, in that much work has not happened in mind-body medicine. But yes, Dr. Herbert Benson has done significant work. There are series of books. His first book, The Relaxation Response, is about mind-body medicine. If we can relax ourselves, we can heal many of our diseases. Now we are coming to understand that stress is the most profound factor in almost every disease. The more mind-body medicine you understand, in that proportion, you will give that much importance to stress. I came to realize this. Those who are not practicing mind-body medicine, or who don't able to comprehend it, they will say, yes, stress is important. Go for walking. It's good. It's okay. But when we understand the importance of stress, then we will understand that more than walking, it's yoga, which is helpful. And when we will go deeper, then we will realize it's Yoga Nidra, guided relaxation, PMR, progressive muscle relaxation. That is the most helpful part in yoga, to relax, to de-stress, to eliminate stress from your life, not just manage. Being a strong advocate of mind-body medicine, I am not in favor with the word that reduce the stress. When it is possible to eliminate the stress, why to reduce or why to manage? Learn to eliminate stress from your life or from life of your patient. If you can eliminate stress from the life, healing, significant healing is guaranteed. Before relaxation response, we have heard flight or fight response. Whenever there is danger, when there is some fear of mishap, either we run or we fight. In both cases, there is surge of adrenaline in our body. Our blood vessels gets constricted. There is more blood supply to our limbs, and there is less blood supply to our vital organs, our heart, our kidney. Heart is also an organ. Heart also needs blood supply. So if we are living with the mindset of fight or flight or stress, our internal organs can't get good blood supply. It will be in our limbs. So we have to learn that we don't live in always in fight or flight way. The opposite of fight or flight is relaxation response. Fight, flight, there is one word, another word, freeze. In many cases, patient gets freezed. They can't move, they can't take decision, they can't take proper action. That is also a stress. After relaxation response, very recently, we have started studying PNI. This is the latest development in mind-body medicine, psychoneuroimmunology. PNI is also known as PNEI, psychoneuroendocrinoimmunology. What does it mean? Psycho means mind. Our mind influences our neurons and our immunity in very plain term. when we use the PNEI, psychoneuroendocrinoimmunology, our mind influence our hormones and our immunity and our neuronal structure, the spinal cord and brain. So when people think in terms of that there is hormonal imbalance, in many cases, when there is no mention of hormonal imbalance is there. If there is, like in case of female, if period is not regular, don't we think that there is imbalance in estrogen and progesterone, that production and distribution is not proper? In mind body medicine, in energy medicine, we give much importance to such minor things which get ignored in mainstream medical practice. So psychoneuroimmunology, we have to understand, in Europe there is proper institute on PNI, Institute of PNI in Austria, in Germany. But yes, this trend has to come in every country. In India, there is no systematic course on PNI. That's why we call India as a developing country. We have to develop a lot. In clinical practice, there's one clinician, pediatrician with the name Hilary McLafferty. She has worked what all therapies are being practiced, which are evidence-based. In medical science, there's so much emphasis on evidence. Is there evidence? In this regard, I want to quote Professor Ian Harris of Sydney, Australia, surgery professor, who has written Surgery, the Ultimate Placebo. He says, instead of evidence, we have to think in terms of science. Medicine should be science-based. Evidence can be tampered, there can be bias in evidence. What is the difference between evidence-based science, evidence-based medicine, and science-based medicine? Much discussion is required. I am not going in that area. We have to develop scientific aptitude. Even medical doctors who think that they have scientific attitude, they have to develop, they have to deepen scientific aptitude. So there are 6 established therapies as documented by Hilary in her book. These all are in category of mind-body medicine. Each topic needs full day or many days of session to understand fully. So I can't go in detail of each and every concept mentioned here, just taking the glimpse. Breath work. PMR is Yoga Nidra. In medical, they don't call it Yoga Nidra. Yoga Nidra, when we use the term Yoga Nidra, it sounds related to yoga. But PMR, progressive muscle relaxation, there is focus on relaxing. Like one very easy things any of us can do, measure your pulse rate. The normal pulse rate, we have studied in our physiology class in first year of MBBS. It is 70 to 80 per minute. When it's above 80, it's not in category of tachycardia, but it's not normal. In mainstream medical practices, they think that it's okay. There's no need to do anything. But in mind-body medicine, it's important. If there's pulse rate above 80, it indicates there's a stress, there's mild stress in your life. Measure your pulse rate in resting state. That means just close your eyes, be still for 2 minutes, and then measure your pulse rate. Whatever is your pulse rate, that is pulse rate in resting condition. If it is between 70 to 80, well and good. If it's above 80, work on your mind. You have stress, even if it is of mild level. Practice PMR or breath work to eliminate stress from your life. Don't manage stress, eliminate stress, end the stress. So PMR is a slow process, guided relaxation. In my voice on YouTube, there is Yog Nidra. I am fan of Yog Nidra. Yog Nidra has been invented by Bihar School of Yoga by Swami Satyananda Saraswati. Incidentally, he found that conscious sleep is possible, and we can acquire, we can learn in sleep state. He refined that method and Yog Nidra appeared. Yog Nidra has been popularized by Bihar School of Yoga. Now every school of yoga is doing Yog Nidra. That's good. But the basic work has been done by Bihar School of Yoga. I have visited Bihar School of Yoga once for 1 week, and in every day in noon time there was guided Yog Nidra by our teacher Acharya. So PMR, guided relaxation, progressive muscle relaxation. In breath work, there are two versions of breath work. In one version, there is with the music, we do systematic, conscious, synchronized breathing. That is a more popular method of breath work. For 30 minutes, for 40 minutes, you keep breathing with the music rhythm. You don't stop. Although you feel to stop, but you don't have to stop. So this breath work, this continuous breathing releases many suppressed emotion. Even I have found that when I practice breath work, long memories of long time starts appearing in my conscious mind. And if there is some emotion which are not healthy, you can work on them. In second version of breath work, which is known as bio body breath work, Dr. Sandeep Hasin, who has came on our platform, I learned bio breath work from him. In that bio breath work, with breathing, the therapist press muscle of the body from the elbow or from any body part. So when the continuous deep breathing is happening and when the muscles are getting pressed, so the memories in bio breath work, there is philosophy that memories is not in brain, memory is in our body, in our muscles. Stress is in our muscle, right? When we have stress in our mind, it gets stored in our muscle gets stiff. So memories are also stored in your muscles. There's concept of cellular memory. Each cell of our body has memory. So when pressing the muscles, stored memories of past time starts appearing. In that bio breath work with Dr. Sandeep Hasin, I started getting memory of long past lives and beyond past lives. Those falls in category of spiritual medicine. So I'm not going to discuss, but yes, it's a very profound, very interesting practice. There's biofeedback, hypnosis. Hypno is sleep like a state. In hypnosis, you can command your subconscious mind for different practices. On the basis of hypnosis, there are many guided practice, guided imagery. You can visualize is your spirit guide, your non-physical friends. You can visualize colors. You can visualize stars. We can visualize different bubbles which can eliminate your pain. There are many visualization practices. There are many wonderful books on guided imagery. There is one book by Dr. Newton Kondaweti, Consciousness Heals. Many visualization methods has been mentioned in that book, and it's a good book. Mindfulness and meditation. Mainly mindfulness is more popular in academic community, in medical community so far. But in mindfulness, there's tendency to live in now moment, to be here and now. Don't think about past, don't go in future. Learn to live in your body. When you are moving your hand, in your backdrop of mind, you should be aware that my hands are moving. When you're walking, you should know that your legs are moving. They are MBSR by Dr. John Kabat-Zinn. Dr. John Kabat-Zinn is also a legend who has popularized mindfulness and mindfulness-based stress reduction, MBSR. There was a session on MBSR on our platform. And Dr. Sandeep Jyoti is also a practitioner of mindfulness and MBSR. So focus is on reducing the stress. In each, we are learning how to reduce the stress, how to not go on that emotion. The ultimate things comes in these things is emotion. Our mind has three things: emotion, thoughts, feelings. So in each therapy, we are working on emotion. We are working on feeling, how to generate good feelings. One spiritual teacher, Esther Hicks, says, if you are feeling good, keep feeling. So we have to learn how to maintain good feeling in our life. There's art therapy, drawing, painting, mandala drawing. There's movement therapy. In my energy medicine, those people who have issue of anger or excessive weight, in those cases in which there is imbalance of gallbladder meridian, I recommend walking in the figure of 8. Draw figure 8 in your backyard or in park and walk on that imaginary figure of 8. That will help in reducing your body weight. There is Tai Chi, there is Qigong, there are many things in movement therapy. Each practices required a lot of pondering and learning. I will focus on emotion here today. What are the common emotion? There are Navrasha in classical dance, in drama. There are 9 types of emotion which a good artist has to learn to display in his acting, in his or her facial expression. But from the healing point of view, we will just focus on 3 emotions. One is anxiety. Anxiety is quite common. Many people are facing anxiety in their life. If there is anxiety in your life, learn to handle it, learn to reduce it. In mind-body medicine, we give more importance on mind, on emotion. Unless you will heal your emotion, your body can't get healed. So if you realize that you have anxiety, or the other unhealthy emotion is fear, anger, these 3 emotions are most problematic, most disease causing. If you can eliminate these 3 emotions, anger, fear, anxiety, no, my dear friends, you can heal each and every disease. How you will heal, that's another matter. For that, we have to learn deeper aspects of mind-body medicine. But the things, if you are not getting healed by whatever method you are doing, if you want to take help of mind-body medicine, learn to relax. Among all 6 mind-body therapies which we have seen just now, most important in my experience is relaxation response, progressive muscle relaxation, Yoga Nidra. If you can't sit or lie down for 15 minutes by will, if you can't close your eyes for 15 minutes by will, when you want to close your eyes for 15 minutes, then don't expect healing will happen. But yes, if you can sleep, Yoga Nidra, PMR is conscious sleep, is not sleep, full sleep, unconscious sleep. Although sleep is also as a form of medicine. In lifestyle medicine program, there is sleep medicine. In future, we will try to cover sleep medicine here. So learn to handle your anxiety, your fear, your anger. How to handle that? For that, we have to learn relaxation. Relaxation, PMR, takes you to alpha state. When you are sleeping in your room, when you have just came out of from market and you are just relaxing in your room, you close your eyes. Whenever you are relaxing with closed eyes, there is a probability you will be in alpha, unless you have very stress of very high level. In rare scenario, that may also happen. Even though when you are relaxing, you have your brain is in beta state. When we are thinking in terms of brain wave, the stress is high beta. In medical, we used to study that it's 14 to 30 hertz. When brain wave, the frequency of brain waves 14 to 30 hertz is beta. But practically, it is not that much important what is the frequency. We have to understand when we are in beta, when you have stress, you are in beta. When you are thinking with open mind, open eyes, you are in beta. When you are doing calculation, what is the expenditure of this month? Whenever you are doing any math, you are in beta. When you are thinking in terms of logic, you are in beta. So in beta, there are two states, low beta and high beta. Low beta is okay to live our normal routine life. But high beta is problematic. In high beta, your hormones started getting imbalanced. Your pulse rate shoots, your BP rises. In high BP patient or migraine patient, even if they learn how to be in alpha, your migraine will be get healed, guaranteed. If you can, I have experienced single sitting of Yog Nidra heals migraine. Being in alpha is that much powerful. Learn how to cultivate the alpha. So little bit practical. So just sit straight. I want to take you in alpha for 2 minutes. Sit straight. If you want to take back support, you can take your back support. And you have to take deep breathing. And in deep breathing, you have to focus to two things. You have to inhale from your abdomen. Our air doesn't go in abdomen. Air goes only in lung. When I was a child, I used to think when we say that inhale from abdomen, air goes in lung. How come lung goes in abdomen? Then later I realized it's not the abdomen, just the diaphragm which separates lung and abdomen. That descends. The volume of lung expands. So abdomen extends, but the air is still in lung. So when we say that inhale from abdomen, inhalation is happening only in lung only. So inhale deep, you have to inhale from nose and you have to exhale through mouth. And when you are exhaling through mouth, you have to be very, very slow. The more slow you can be, the more relaxation will follow. So one easy way of doing slow exhalation is blowing, like you are blowing a candle. So inhale through nose, exhale through mouth, and with closed eyes. Let's start. Begin. Kindly close your eyes. Deep inhalation. and exhale through mouth. Again, deep breathing. Exhale through mouth. Slowly. The more slow you can be, better it is. Do on your own pace. Kindly keep your eyes closed and keep doing deep breathing with slow exhalation from mouth. Now stop doing the breathing, active breathing. Keep your eyes closed and feel your body, your legs, your arms, your neck, your shoulder, your ear, and just be. Relaxation is a passive process. You need not to do anything from your mind, from your conscious mind, from your active side. Just feel your body and be. Just 30 seconds more. Just be with yourself. Be with your body. Feel your weight. Feel the touch of surface on which you are sitting upon. Last 10 seconds. 7, 5, 4, 3, 2, 1, and 0. Slowly put your palm on your eyes and gently open your eyes. How are you feeling? You can comment in the chat. This is not meditation. This is relaxation, alpha relaxation, being in alpha. Those people who have high BP or migraine or headache, just doing every day, 5 times a day, every 2 hourly, 3 hourly, just do deep breathing and be observing your body for 2 minutes, not giving much time, and see effect in 1 month. Your dose of BP medicine have to be reduced, and in some cases it will be, you have to stop. Being in alpha is that much powerful. When we are in alpha, when we practice alpha for longer duration, 15 minutes, 30 minutes, what happens? We start observing our emotion. And if there is emotion of fear or anxiety or anger, we have to work on 3 emotions for healing purpose. Although emotions are of 9 types, Navrasha. When the emotion appears, you have to dissolve them. If there is anxiety, learn to relax. Learn to have faith on divine. Learn to have faith on your ability, on your capability. Yes, I can do it. Louis Hay used this affirmation, I can do it, with many people, and they got healed from their anxiety. When there is fear, antidote of fear is faith and courage. When you have faith on higher power, if you feel there is higher power, and most of us are believer of some higher power here, so you have faith on higher power. When you connect with your higher power, you will conquer your fear. And courage. Capture your courage again, like Hanumana. When he was about to jump the ocean, Jamvant reminded him of his courage, that you can do it. You are Vayuputra. And he did it. You have to learn to remind yourself. If you are blessed enough, if you are lucky enough, there will be some Jamvant in your life. Otherwise, you have to tell yourself that, yes, I can do it. After this 2 minutes of alpha relaxation. In relaxation, we can dive in theta. I am not going in that part now. Just alpha, just deep breathing and observing the body. Theta is more complex, and there are many things in theta. More than theta, in my experience, after the theta, delta comes. 0 state. 0 to 4 hertz is frequency of delta. Being in delta is very healing. Deep healing happens in delta. Healing of DNA level can happen in delta. If you can attain delta state, and if you can stay in delta state. 2 things, attaining the delta state and staying in delta state is required. Attaining is easy by technique, by method, by guided delta meditation. One can attain the delta state. But if you have not learned to reduce unhealthy emotion from your life, anger, fear, anxiety, you can't sustain in delta for long. So it is not just touching the delta. Being in delta is required. Sustaining the delta is required. Like I work on cancer patient. When I realized that healing happens without medicine in every cases, so why not to heal cancer cases? So I am more focused healing cancer without medicine. So when we can attain delta, every healing is possible. In the course of treatment of cancer, it is not just treatment. Remission should not happen. If there is remission, treatment is of no use. So in most cancer, 5 years is observation time. No remission, no recurrence should happen in 5 years. But in some cases, remission can happen after 10 years, after 12 years. So one has to be cautious throughout the life. There are cases in which in breast cancer cases, recurrence happened after 12 years. So one has to be very alert. Unless you are working on your emotion, the healing is not permanent. Unless you are being in delta. So how to reach delta? And what is delta? Is 0 to 4 hertz, very reduced vibration frequency. Brain is not thinking anything. Either zero thinking, 0 hertz is 0. Brain is not radiating any wave. It is not working at all. 0 hertz. But 4 hertz, yes, it's working, but very minimal. So what to do to be in delta? And that is main meditation practice. If we will study meditation properly, in Patanjali Yoga Sutra, yoga has been defined as yogasya chitta vritti nirodha. That is delta state. If we can correlate both terminology, brain is not radiating any frequency, and in here Patanjali is writing no vritti in chitta. There is nirodh. The thought forms has stopped, thought waves has stopped. So the main part of meditation, the real meditation, is delta state, no thinking, any thought. If you want to attain good depth in your meditation, learn to practice alpha. More you will practice being in alpha, at the time of delta, you will go in delta. Otherwise, what will happen? You are trying to meditate, but you are not trained to be in alpha, trained to stop that beta. You will be only in alpha state, or you will just touch and you will return. It is not just being in delta, sustaining in delta. Staying 0 or minimal. 0 hertz is ideal. 0 hertz is samadhi. 1 hertz, 2 hertz, 3 hertz, 4 hertz, that is deep meditation. In my terminology, that is meditation, but for many, it will be deep meditation. There are schools of meditation who call being alpha as a meditation. That is just relaxation. We have to understand healing in alpha, very minimal healing happens. Only in case of migraine or BP, I feel healing happens in alpha state. For deeper healing, you have to be in delta. While going in delta, sometimes we will fall in theta. That is 4 hertz to 7 hertz, 8 hertz. In that state also healing happens. In that state, we get dream. When we are studying with a dream, it has been noticed that that state in which dream happens is more healing effect than a state in which there is no dream. Healing has also role. Dream has also role in healing. In spiritual medicine, we will study the dream. Mind-body medicine and spiritual medicine touch the boundary, but dream is not very much has been explored. Alternative healers, shamans, Jungian psychologists. In psychology, there are many branches. Those who follow Carl Jung. In Jungian psychologists, they study dream. So Dream state is theta state. For now, we will just practice delta. Our time doesn't permit to explore each phase in detail. So how to be in delta? Delta is the finest vibration frequency of our brain. Let's correlate it with 5 elements. We have 5 elements in our physical body. What are those? Earth, water, fire, air, space. Relaxation or meditation is process of going from gross to subtle. Among those 5 elements, the finest is space. Second finest is air. So when we can observe the air in our body, breath is air. You will be in frequency of air element. And when you will feel the space, you will be in the frequency of a space element. So formula of being in delta is feeling space. Provided your mind doesn't regress to beta state, anxiety, or any unhealthy emotion. So practice being in alpha 5 times in a day for 2 minutes or more. And while you want to be in delta for 15 minutes, we will go in delta now. The formula is delta is feeling the space element. And there are 2 ways to feeling that space element. One is the space between the breath. When we will feel the breath, we will attune ourselves with air element. And when we can feel the space, we will attune ourselves to a space element. Both we will transport us in meditation or deep meditation. So first we will observe our breathing, and after some time, 5 minutes or so, we will feel space between the breathing. Feeling the breath itself is very relaxing, very healing. You get attuned with the air element, and feeling the space between the breath transports us to delta state, 0 state. Keep observing. And another way of feeling the space is feeling the space behind the eyes, the third eye space. Among the chakras are not main subject of mind body medicine, but yes, we have subtle energy centers. Among all 7 energy centers, spirituality has connection mostly with the third eye. So feeling the third eye space, the space behind the eyes, is one way to be in delta. So we will use both method.